Welcome back to Newsday. Last year, the management board of First Cardiology Hospital here in Lagos organized a series of open heart surgeries for a set of financially dependent Nigerians. Considering the cost-intensive nature of this health scheme, there was a lot of applause. Just recently, the hospital, in partnership with Healthy Heart Foundation and VOOM Foundation, carried out over 2 sessions, another set of open heart surgeries for financially dependent Nigerians. The overall aim is to continue to offer these services. Well, joining us now to talk about the motivation, challenges and prospects of the open heart surgery scheme is Dr. Yemi Johnson, Chief Medical Director of First Cardiology Hospital and co-founder of Healthy Heart Foundation. Welcome to Newsday and thank you for being here.
Thank you.
I'd like to start by asking why we're seeing a rise in the number of heart attacks and heart failure in Nigerians lately. What's going on?
Well, I do not know if it is a rise, as you say, but just more awareness that this is going on. Heart disease has been with us for quite a while.
Mm-hmm.
True, back in the 70s, 80s, we didn't have that much coronary artery disease, but now we do. We're trying to catch up with the West.
We're still here with Dr. Yemi Johnson, the Chief Medical Director of First Cardiology Hospital and co-founder of Healthy Heart Foundation. And as you were saying earlier on, you were talking about the increase in awareness of heart disease and heart failure, basically. So please go on.
Okay, like I said, yes, there's more awareness. People are more aware of heart disease. There is also an increased incidence of heart disease in Nigeria, in West Africa, in Africa as a whole. And in the past, it used to be infectious diseases that were the most prevalent diseases. But now, things like heart disease, lung disease are all rising. And that's due to several factors. One is the rise in obesity. Mm-hmm. We're beginning to get, there's an epidemic of obesity in Nigeria. There's also a new epidemic of diabetes. These are all risk factors for heart disease. And we've started to eat badly, fast foods, fried foods, and we are no longer exercising. Now everybody takes their car, parks right in front of their door, or takes Okada right to their house. In those days, we used to go by bus and then walk about a mile to where we're going. So we're doing all the things that cause heart trouble.
Mm.
So I want to firstly commend you and your colleagues for making these surgeries available to people who otherwise wouldn't be able to afford it. But we've heard comments recently from the Minister of Information and Culture, Mr. Lai Mohammed, imploring Nigerians to not go abroad for medical tourism. What is the cost of one of these open heart surgeries, and is it prohibitive for the majority of Nigerians?
Yes, it is quite expensive. And it's not because the doctors or hospitals are trying to make money, it's just the expense, the equipment you need. The consumables, the medical equipment, the valves, or whatever we use is expensive. We don't make anything in Nigeria. And so everything has to be bought from abroad. And especially after COVID, there was an interference with the supply chain. So things became much more expensive. And it's a very expensive thing. It depends on what kind of surgery, but the cost ranges from 4 to 15 million naira. So it depends on what the problem is. And most of the expense is in drugs, medical equipment, and things like that.
So considering how expensive it is, can you tell us what motivated the Healthy Heart Foundation and First Cardiology Hospital to actually make these surgeries free?
Well, that's easy. Let me go back a bit. I came back, I trained in the US, I worked in the US for about a long time, 28 or 30 years, somewhere around that. And I used to see patients, Nigerians, go abroad for minor things. And that really got to me somehow. And I said, I have to come back and at least do something before I retire completely. And I lost my train of thought there. What was the question again? Let me...
You know, what motivated you to make the surgeries free?
Came back and started doing procedures and found out that most patients can't afford. So you see somebody who doesn't have much money coming with a heart attack, and you can't do anything because you can't afford it. So that really made me feel bad, and I said, we've got to do something about this and help the common man. There's no point coming back home, giving the elites the services we have, and then we can't serve the common man. Then we haven't succeeded as a country. So we have to help somehow or the other.
Very well said, but I'm curious as regards the criteria for the services that you offer, because you just said it's not offering the elite, and clearly you provide these services to the dependent Nigerians who, excuse me, who are financially dependent. Thank you. So I'd like to ask, what's the criteria? I don't want to say but if someone randomly came to you and said, "Oh, I need your help," what would be the checkpoints that you need to, tick to be sure that they're not?
That's a difficult thing to sort out. It is difficult. Luckily, that's not my job. My job is just to treat whoever comes along. But they do have some criteria which I don't understand how they do it. And Lagos State, for instance, has a department where they figure out who is really unable to pay. And we try and work with them to help guide us as to how to choose. Because I've had some patients who I know can afford this thing, and then they disappear. Then you suddenly see them when the free services are on. So people don't like to pay for healthcare. That's just the bottom line. But we can't, because of a few people who want to scam the system, not provide services for the poor people. We just have to.
So the high cost of these services and these procedures is a real issue. I think we all agree on that.
Yes.
But what can the government do to tangibly lower the cost of these services? You mentioned that there's a lack of domestically produced medical materials or equipment. To build these factories to be able to produce that's a big ask. What else can the government do?
That's a delicate question. I've got to be careful how I answer this. Politics is all around us now. Truth is, there are a few things, policy-wise, a few things the government can do. All right? One is to make it easier for things to come in to the country. Now, we've got certain government agencies that are supposed to protect us, like NAFDAC, who's supposed to make sure whatever comes in is legit. But the way it works these days is a company like Johnson & Johnson, it is difficult for them to bring in things legitimately because it costs a lot more. So something that would cost $100, to bring it into Nigeria, because of all the red tape, it'll end up costing $500. Same drug in Lagos. I'm just using $100. Same drug in Lagos that costs $100. In Turkey, it will cost $25. Same drug, same manufacturer. So these are the kind of things that we run into that the government can make it less difficult to get through. Customs too. Not supposed to charge health care products more than 5% duty, but it doesn't work out that way. It doesn't work out that way, and I found out it's not because the customs people are just mean. There's some problem with the documentation that has to be tight, so you get your 5% discount. Then, of course, they can do things like they do in India, which actually CBN did recently. There was a health fund, intervention fund. So some of us took advantage of that. We got low interest loans, and we're able to build some more facilities and buy equipment at a cheap interest rate. Normal interest rate in Nigeria is about 20-something%. But CBN got us these loans for 7%, and 7%, which is quite good. So they're already doing the things, but I do understand that the country is not rich right now, so it's difficult. But one critical thing, the most critical thing is healthcare insurance. If healthcare insurance is made compulsory, we will be on our way to fixing healthcare completely in Nigeria.
Now, I'd like us to talk about the success rate of open heart surgery in Nigeria, and then also tell us some of the most common complications that could develop after the surgery and how they can be managed. Okay,
that's something that it's nice to be able to talk about. Success rate is in the high 90s, 95 plus. Complication rate is not that high. Once success rate is high, the complication rate goes down. And that's because we have the expertise. We do. Nigerians everywhere in the world are at the top of their game in every department, in every specialty. There's a Nigerian who's at the top of the department. So we have the expertise. You see all our doctors are going abroad now. They're not going abroad, they're not taking people who can't work, who can't do the job. They're taking the best of our people, but we're still able to carry on. So yes, we have the expertise. Complication rate is low. Maybe I would say infection would be one of the common complications, but so it is low.
That's fair and very commendable. The numbers are really high. So what do you see in the next 5 years regarding this goal of yours?
Okay, let me put it this way. In cardiology, we can do almost everything at a high level except heart transplant. So my goal is in 5 years' time, we should be able to do heart transplantation in Nigeria. We're already doing kidney transplant. So the next step is heart transplant. So that's my own personal goal. To bring, once we start doing heart transplants, then I can retire.
Excellent. So the services that you and your colleagues have provided for people who can't afford them here in Lagos is fantastic. But Nigeria is obviously a country of more than 200 million people. And this is not an issue that only affects people here in Lagos. Across the country, there are individuals, as you say, with this epidemic of obesity. Can you give us a bit of a lay of the land as to the situation in other parts of the country and whether there are other people like yourself doing these sorts of things?
Oh, yes, there's quite a few of us. Cardiac surgery or...
Correct.
Yes, there's quite a few of us doing cardiac surgery now. But everything is based either in Lagos or Abuja. And most of the patients come from out of town. So once we can solidify things in Lagos, Abuja, we can start going around. And in all fairness, the government has actually provided funds for hospitals outside Lagos, like in Sokoto, Kano. They provided funds for them to get the equipment used for cardiac surgery. So things are going on. The government is actually doing a decent job. I just know that there isn't that much money for them to throw around, but they are doing a decent job. There's some government hospitals doing heart surgery as well. So things are much better than they look or people talk about. You know, social media specialty is bad news. And good news doesn't spread that fast. But the healthcare has come a long way.
Well, Chief Medical Director of First Cardiology Hospital and co-founder of Healthy Heart Foundation, Dr. Yemi Johnson, thank you so much for coming on Newsday.
Thank you.